is difficult, this, isn't it? It's not quite as simple as, they said following the science, but if the science is leading you in a completely opposite direction, that's quite hard to spin and sell, isn't it, I suppose? Anyway, let's speak to Dr. David Nicol. He's a consultant neurologist from Hagley, Lib Dem parliamentary candidate for Bromsgrove at the last general election. Morning to you, David. What do you make of the report? What's your reaction?
I'm really not surprised. This was, absolutely open in plain sight. 15th of March 2020, the foreign minister of South Korea explained on the Mar Show why they'd been so successful, and we didn't listen. And even just
why? If there's things that work around the world, why didn't the British government listen or take some notes?
I don't know. I mean, if you listen to what Chris Whitty said, he's always said advisors advise ministers decide. And, we know at the beginning of this that Boris missed 5 Cobra meetings. We just didn't take it seriously enough. And, the reason Asia did so well last year is because they had dealt with SARS. So they locked down immediately. And despite taking back control, we failed to control our borders. That's one of many examples. And also, the whole PP issue and things. And, I don't think we've still learned. We're still making mistakes. We're still dithering.
You've been through all of this, haven't you? As a doctor, you've kind of been in healthcare settings. You've been in hospitals. What in the early days? Thinking back to the sort of the start of this, which is what this report is talking about, isn't it? What did the government's decisions? What effects did they have on the areas you worked in?
Well, we failed on PPE supply in many areas. I was very fortunate where I worked, but fundamentally COVID is airborne. We should have been using higher grade PPE. FP3 masks in all critical areas where there's any risk of catching COVID.
But David, actually, I remember I interviewed you at the time, and you weren't sure. You actually said that there's no point in wearing masks at the beginning, and then you changed your mind. So I mean, this is a problem. Yeah. That Sir Patrick Vallance pointed out in the clips. The advice changed, didn't it?
That's fair, but I was actually really worried we weren't going to have enough masks in hospitals. And I changed, actually, there was a paper that came up from Drish Greenhill, Professor of Primary Care in Oxford, which just made this clear. There were people waiting for randomised controlled trials. You don't do randomised controlled trials in a pandemic. You act quickly, and we didn't. We did it.
Yeah, but even if someone like yourself, David, who's a medical professional, if you weren't quite sure, you can understand maybe why the public got confused by the mixed messaging.
And that mixed messaging still happening. And in fact, it's interesting you're saying about politicians making U-turns. Sajid Javid wrote a paper he was doing a project with Harvard University last year, and he talked about the importance of U-turns in a pandemic. We didn't listen.
I mean, a lot of people are saying this is all hindsight, isn't it? It's easy with hindsight, and the government would have been damned if they did and damned if they didn't. Whatever they did was going to be wrong in the eyes of some people. That's also fair, isn't it?
No, in fact, if anything, this report is actually quite gentle, not least because the chair of the Health Committee is Jeremy Hunt, who walked out of the planning Operation Singus in 2016, because this was looking at the ethical dilemmas that might be facing a pandemic if they ran out of ventilators, and he refused to play. So actually, although this report is damning, it's not as damning as the public inquiry will be.
And what do you think that's going to throw up? Because that's next year, isn't it, the public inquiry?
Well, I mean, it's just I suspect more of the same, but with bigger volume.
Dr. David Nicol, good to speak to you, consultant neurologist from Hagley. So